And now the moment for which we've all been waiting. I would like to begin our awards presentation by acknowledging all Action Group members for your dedication to educating the public and professionals, as well as providing influenza vaccinations to our communities throughout the state. Although today we are spotlighting only 3 of our members, everyone's efforts should be applauded. Here are some of the flyers from events held in Newark, Trenton, Union County, and Paterson, which were shared with us and posted to our New Jersey Power to Protect website. I'm sure there were many more, so thank you. Next slide. We had so many event submissions from one Action Group member that we wanted to give our first shout out to Ocean County Health Department, OCHD. Located in central New Jersey, OCHD is headquartered in Toms River and serves a population of about 650,000 adults and children. In their flu vaccination brochure, by my count, there were 34 events scheduled, but I've been told there were many more. The staff has done an amazing job with their flu website, which includes flu prevention tips and frequently asked questions, information on treatment and resources. OCHD also provides information on flu and flu clinics via the department's app and various social media platforms. Next slide. We would also like to acknowledge the work of CAMCare Health Corporation, a federally qualified healthcare center with 7 locations across Camden and Gloucester counties in southern New Jersey. CAMCare offers flu vaccines 6 days a week at 6 of 7 locations. We're going to show you a promotional video that CAMCare created regarding their support of flu vaccination. Just terrific. And I have one more slide if we can have that shown. Thank you. Finally, out in the northwestern part of our state, St. Clare's Health decided to take patient outreach to a new level. Armed with our 2 Protects 2 educational materials, the parent education team at the Katina Center for Mother and Child at St. Clare's in Denville dedicated themselves to making sure that all patients delivering at their facility knew about the importance of receiving their flu vaccine to protect themselves and their babies. This involved creativity, determination, and using the personal touch, which, as we all know, goes a long way in spreading any important message. And now I'd like to invite my guests to turn their cameras on. Great. We have everybody? Okay, excellent. Well, joining me today, we have Scott Carter, who's the Chief Administrative Services Emergency Preparedness for the Ocean County Health Department. I want to give a wave, Scott, thank you. And we have Melanie Berthott, Director of Nursing from CAMCare. And we also have Anne-Marie Oswald, Patient Care Education Coordinator from the Katina Center for Mother and Child at St. Clare's Health. Thank you. Well, congratulations. Thank you for agreeing to participate in a brief Q&A so we can share some information about your events and your experiences with the other action group members. So the first question is really for everybody. If you could just give a brief overview of your organization's flu initiatives for the season, that would be great. I didn't go into them at any huge length in my presentation because I'm sure people would rather hear from you. Melanie, why don't you start?
Good day, and I wanted to also add, I do have Flossie with me. She's over there, but she's participating. So thank you all for attending, this discussion. For our initiatives, we offered vaccines to 6 out of our 7 locations. We offer it during well visits as well as sick visits. When we're administering COVID vaccines, we are educating and offering as well the flu vaccine. We're also hosting community events at schools, faith-based organizations, adult day centers, et cetera, to really just push the education out there, and of course to administer as needed for those folks.
Great, thank you. And Scott, how about a little overview of Ocean County?
Sure, afternoon. So as the primary health agency for Ocean County, we cover 21 of 29 municipalities with about 55,000 residents that are kind of assigned to us as the health department. We have a large senior population. We have a large transient population within the county. So that kind of gave us the ability to go out not only in written form, but to get out in social media, but actually get out in a public setting by taking a lot of our mobile vans and be able to actually go into parking lots and go into these areas that we know are crisis. And we were able to really be successful this year with our program.
Thank you. And Anne-Marie, last but not least, tell us about the parent education program out at St. Clare's.
Good afternoon. Thank you. So what I did was I went out to the 13 OB offices that we have in our community, 1 prenatal clinic, 1 pediatrics clinic, and also maternal fetal medicine. And I passed out the brochures and posters from the partnership and asked them to put them in all the prenatal folders that they give out to the moms so that we can get the word out that way, as well as the information that I give out in our prenatal. We're doing e-classes online as well as Microsoft Teams meetings. So I send all our pregnant moms who are in our classes information through the mail. I also sent them flyers as well. So make sure we get the word out to everybody.
Great, terrific, thank you. Scott, can you tell us a little more about your flu brochure, which I happen to have a copy of it here, and this distribution, and how you ensure people in the community know about your events?
The brochure that you have is just one piece of our marketing. Because of our large senior population who are not really strong with public media, social media, we go to a printed brochure. So we pick our locations pre-designed, we print them out, go to each municipality. So each municipality gets those. They go to our county library system, our mall. We get them to actually then post that stuff on the social media for us. And then we also utilize a canvassing team where we know that we're going out to our pop-up clinics. We'll utilize those canvassing teams to hand out those brochures. So at least the individuals are aware of that. One of the other things that we do with the brochures is we know that the restaurant industry struggles with a lot of undocumented staff because we're a SURE agency as well. We take that to the restaurants and say, here, this is where we're going to be. If you have any staff that need to make sure for protection, come on over and visit. So although the world's in a social media platform, we've found that the actual print brochures have been very beneficial for us.
Great, that's terrific. Melanie, did you want to speak a little bit of how people in your community get the word about CAMCare's events and services?
Thank you so much. Yes, we do plenty of outreach into the community. We have numerous networking, I guess, and resources out there to partner up with us. We utilize social media as well, Instagram, Facebook, Twitter, and we also, we post it in all of our locations to really get the word out. And what seems to work for us is really also word of mouth. The communities, really do trust us, and we really appreciate that, and we take it to the next level and ensure that we over communicate rather than under.
Thank you. I just wanted to read this quote from Dr. Monica Burton, who is the Director of Pediatrics for CAMCare, because we were really struck by it. So Dr. Burton said, at CAMCare, we recommend flu vaccines to all babies, children, ages 6 months and older. Influenza A and B circulate in the community primarily in the winter months. Although influenza is generally an acute, self-limited infection, it can be associated with significant respiratory problems and death. When the community gets vaccinated against flu, we not only protect ourselves, but we help to protect all those around us. We are able to give the flu vaccine when your child is well or has a mild illness. We strongly urge everyone who's able to get their flu vaccine as soon as possible. And of course, the clinical team is vaccinated against the flu. So that's certainly a very strong message from a trusted provider. How else do you get people to participate at the events? Do you want to handle that, Melanie? You want to take a shot at that?
Absolutely. It really is, yes, education, of course, but to bring excitement, to take care of yourself. There's a lot of, push that at least we believe in terms of don't forget to take care of yourself. How are you going to take care of others if you're taking care of others, if you haven't taken care of yourself? And so a lot of that really is just, education, but then the excitement surrounding, taking care of yourself and preventing illnesses with a vaccine.
Got it. And Scott, how about in Ocean County? I know you talked about having more than just flu vaccines available at a site.
So we've done a couple of things. We have a program called Live Healthy Ocean County. So we take that to our health fairs. We take that to our senior communities and our partners that are there, which then comes with a health educator, comes with a nursing staff, just to handle all of the other health department questions and sickness and mental health and anything that they should have a need for. But this year we brought, along with all of our COVID vaccination response, we brought flu to everything there as well. So it was kind of a one-stop shop that they come in for any of the vaccines that they wanted, get their vaccine and their flu or just their flu program, whatever their choice was. We incorporate pneumonia into each of those clinics as well.
Fantastic.
Amy, if
sure.
we all,
Did somebody want to say something? Okay.
we also offer our flu vaccines to all our postpartum moms. And I'd have to say 99% of our postpartum moms take the flu vaccine, because we do tell them that they need to protect themselves for their infants. And 99% of our employees here at the hospital this year had their flu vaccines, which was very good.
Excellent. Excellent. Yeah, I know it's that you do it right on the postpartum unit, right? You offer it to the patients while they're there. So Anne-Marie, how do you prepare for those physician office visits?
This year, because of COVID, I found that when I got there were signs on the door that said I had to call. But I just called from my car and said, I'm here to drop off some flyers for you guys, and they let me in. I really didn't have any problem, and they said fine. Although there might have been some patients that were standing outside waiting to go into the office, they welcomed me.
That's great to hear. I think you told me about some creative things you did with posting flyers in places where patients would see them?
Well, here in the hospital, I post the flyers in the bathrooms, so that I know there's 2 bathrooms out here in my hallway that I know patients stop in. So I made sure that there's posters out there. I made sure in maternal fetal medicine that they post them in the bathrooms in their offices and in the ultrasound rooms, non-stress test rooms, as they're sitting there, that they can read them as they're getting their non-stress test done.
Excellent.
And I asked the doctor's office to post them in their waiting room as well as in their exam rooms.
Great.
As well.
Great. Meeting the patients where they are. That's terrific. So now I'd like to throw it out there. What were some unique challenges this year with the impact of COVID-19? Since we can't ever have a program without mentioning COVID, it seems, in the last 2 years.
So we went from almost no flu vaccination last year to probably just over 10,000 doses this year. And our biggest challenge was really saying no to individuals that wanted to host locations and clinics. And we were doing probably 2 to 3 events per day over the 5-day period, and it was a challenge. You know, we didn't want to say no, but we needed to kind of figure out the best locations and have some people travel just a little bit. And the second problem that we saw that we didn't anticipate was our Homebound program skyrocketed for homebound needs and homebound flu vaccinations. Many were afraid to come out during the world of COVID, and even still to today, because of their immunosuppressed, their concerns that they didn't want to come to the larger fixed sites that we had. So we wound up building out our Homebound program with some of our additional nursing staff to take care of that need.
Thank you. And Melanie or Anne-Marie, do you have anything to add? Any unique challenges?
Just some of the things that we have seen down at CAMCare is, is that it's the missed opportunities more so than anything. It's like, I have, am I still shedding COVID, and can I still, there's a lot of inquiries, why should I? If I'm feeling fine, I get the flu vaccine, I might end up getting COVID. So a lot of misinformation as well. So there's a lot of focus on education and really having things in different languages that we can be printed, and to kind of do the myth busters as well, to really just push that communication out, because there's a lot of myths out there, and we, just a simple 1-page tool to go over it and bust those myths really does help. So that's what we've been doing.
Thank you. Anne-Marie, what would you say were your lessons learned from this year's experience? Anne-Marie, do you have your volume on?
Yeah.
What would you say?
I will continue to bring flyers to the doctor's offices to get that information out. I think that's the best way to continue to bring things to the physicians' offices to get them to the patients.
Great.
Yeah.
Excellent. Does anybody have any additional tips to share with our colleagues? I know, Scott, in particular, you mentioned that you had pre-event team meetings, which I thought were very interesting.
We do. We bring on seasonal staff. So this year, I think I had about 130 nurses that were part of our response program and planning to keep them all up to real-time information. As the CDC was changing, not only with COVID, but with flu, you can get flu, you can't get flu together. What we found is that as a county health agency, people are turning to us sometimes for the answers, and because they heard something different on media. So we found that every morning or before any clinic that we had, our clinical nurse lead was giving a basic 10-minute overview of what we had on the table today, what the new changes were with CDC. So that way the messaging was the same regardless of which staff member a person talked to. And we found that very engaging, because we learned from staff that worked in other hospitals and other places what was going on. And we were able to kind of take that in real time and make changes to better our program.
Terrific. Thank you. I think that's a wonderful idea, especially when the information was kind of like the moving target at various times this year. Melanie, did you have anything else that you wanted to share?
I just really think it's just to, empower your staff by, education and really just reassuring them that we're all this, together in terms of, vaccines and vaccinations for our community, and really continue to gain the trust of our community by education and being accountable to them.
Excellent, thank you. And Anne-Marie, any final thoughts or words?
No, I think just making sure that we get those flyers out to our pregnant moms so we can let them know how important it is to be vaccinating, whether it's the flu or against whooping cough. I think they're both important, and I try to make sure that we're even teaching our classes to make sure that we let moms know about that.
Great, keeping it in the forefront of everybody's minds.
Correct.
Well, I want to congratulate you and thank you all again. I wish we were together in person, but you will be receiving these wonderful acknowledgements, certificates, congratulating you. You'll be getting it in the mail. And I want to thank you for being very active members of the action group this year. And now I'm going to turn the meeting over to Emily Haynes, who is the Director of Public Health Initiatives for the partnership, and she'll offer some closing remarks.
Hi, thank you, Amy. Good afternoon, everyone. I'd like to first thank our speaker today, Dr. Kitt, for her wonderful presentation. We learned a lot about how to promote flu vaccine with our healthcare workforce. I'd also like to acknowledge the New Jersey Department of Health Vaccine Preventable Disease Program for funding the Power to Protect New Jersey campaign and partnering with us on developing the materials. I'd like to thank the Power to Protect New Jersey team at the partnership, mainly Amy Gohl, for being the coordinator and collaborating with all of our action group members to highlight all of the flu vaccine events this year to help get the word out. I'd also like to thank Monica Smith and Karam Amadio for helping with the communications part of the campaign. Lastly, I'd like to thank and acknowledge all of our Influenza Action Group members. We have a large group and we're representing all of New Jersey statewide. And I'd like to thank members, especially Scott, Melanie, Flossie, and Anna Marie today, who were able to share some of their tips and tricks for promoting flu vaccine successfully in their communities. Thank you for all of the work that you do to promote flu vaccine and to keep New Jersey healthy and to keep our communities healthy. While this is the last meeting of the season, our work will continue. Please use this group and continue to use this group as a resource and a network for sharing ideas on promoting flu vaccine, sharing resources for getting the message out about flu vaccine and the importance of preventing flu in our communities. Remember, you have the power to protect New Jersey. I thank you so much for joining us today. Have a good afternoon.